What sedation is used for a colonoscopy? Imagine lying comfortably as a doctor carefully examines your colon to check for signs of disease or to prevent cancer. That comfort is often achieved through sedation, which helps make the procedure easier and less stressful. Sedation is almost always used during colonoscopy in developed countries to ensure patient comfort and safety. The type and depth of sedation depend on individual needs, health conditions, and the complexity of the procedure. There are different levels of sedation used for colonoscopy. Minimal or light sedation keeps you relaxed but fully awake, able to respond to commands. However, this level is rarely used because the procedure can be uncomfortable. Moderate sedation, also called conscious sedation, makes you drowsy and less aware of the procedure. You might not remember much afterward but can still respond to verbal cues. This is usually achieved with medications like midazolam, a benzodiazepine that relaxes you, combined with an opioid such as fentanyl to reduce pain. These are administered by a nurse under the doctor's supervision. Deep sedation is more intense. It puts you into a sleep-like state where you are not easily awakened but can still respond to repeated or painful stimuli. Propofol is the most common medication used for deep sedation because it acts quickly and wears off fast. Because of the higher risks involved, deep sedation is typically administered by an anesthesiologist or a specially trained nurse who can monitor your breathing and vital signs closely. In rare cases, general anesthesia might be used, which makes you completely unconscious and may requiring assistance with breathing. This is reserved for complex procedures or patients with specific medical needs. The medications most often used for sedation during colonoscopy include midazolam, propofol, and fentanyl. They can be used alone or in combination, tailored to your health and comfort. The goal is to make the procedure tolerable, so you are relaxed and comfortable, which helps the doctor do a thorough exam. Proper sedation also improves the chances of detecting polyps or abnormalities, supporting effective screening for colorectal cancer. While sedation is generally safe, it does carry some risks. These can include drowsiness, temporary memory loss, or, rarely, breathing difficulties, especially with deeper sedation. That's why it's important to have someone available to take you home and to avoid driving or operating machinery afterward. Your healthcare team will consider your health history, age, and preferences to choose the safest sedation plan for you. Always discuss any concerns or past reactions to anesthesia with your doctor before the procedure. If you're preparing for a colonoscopy, ask your doctor what type of sedation will be used and who will administer it. Follow all pre-procedure instructions, like fasting, to reduce risks. Afterward, plan to rest and avoid activities that requiring full alertness until the sedation effects wear off. Remember, sedation plays a vital role in making colonoscopy a safe, tolerable, and effective screening tool for colorectal health. Always consult your healthcare provider for personalized advice and to address any questions about your specific health needs.